need to update it. We got an update to do.
Oh, yeah.
Just go ahead and start.
Yeah, good afternoon. I want to welcome you to today's board meeting of the Department of Social Services, September 14th, 2021. Call this meeting to order, and we will open by observing a minute of silence, minute of silent prayer or silent meditation. So, thank you. Okay, thank you. So following our agenda today, public comment. We have anybody scheduled? Thank you, Susan. We have nobody signed up for public comment. So you should have received a copy of today's agenda, and we do have one revision to today's agenda, and that'll be an item for discussion. So I guess that do we need to adopt today's agenda with that, knowing we have that addition?
We need to add that, yes.
So if I could have a motion to adopt, knowing that we have one change to our agenda?
So moved.
And a
Second.
Second?
Second.
Thank you. And Susan, could you call the vote, please?
Call for the vote. Dr. Bunch,
Adopt.
Ms. Nelson,
Adopt.
Mr. Dancy.
Adopt.
Chair Cox.
Yes. Okay. And following along here, today's minutes, you should have received a copy of today's minutes, and could I have a motion to adopt the minutes? If there's no changes, please.
Move to adopt the minutes.
Thank you, Dr. Bunch. A second?
Second.
Okay, are those in favor?
Aye.
Susan, could you call the roll, please?
Dr. Bunch,
Adopt.
That's good, thank you.
Ms. Nelson,
Approved.
Mr. Dancy.
Approved.
Chair Cox.
Approved. And I guess we don't need to do that since we're operating all in person here today. Thank you.
We reverted.
I was still kind of in a virtual mode here, so excuse me in terms of that. So first on our agenda today, or moving forward with our agenda, recognition of new hires and retirees. So I'm going to turn it over to Ms. Elliott.
Okay. We are excited to recognize people coming and people going. And people are going for exciting reasons. So let me first say to the folks that are new hires, what we do, no pressure,
No pressure.
no pressure. We invite you to come to the podium here and speak into the mic and tell the board your name and a little bit about what you're going to be doing in the agency and a little something about yourself. So I'm going to start with Stacy Dory. Stacy actually started with us last month, but unfortunately, Adult Services had her out in the field immediately, and so she was unable to come. So is Stacy here? Okay. Seeing around, things, come on down.
Stacy, and no pressure. This is just kind of a welcome, and
Right.
And we started this, I don't know, maybe a year ago in terms of welcoming new employees. So want to welcome you, and if you
Well,
just
good
want to say a few words.
afternoon,
Uh-huh.
and my name is Stacy Dory, and I've been here, I guess it's about 8 weeks now.
We can't hear you.
In the Adult Protective Service Unit. I am actually originally from Pennsylvania. I've been a resident here in North Carolina for about 3 years, and I am brand new to the adult service world. I have about 25 years with child welfare. So I'm very excited to be in this new position and also to be working for Pitt County.
Welcome. Thank you.
Welcome.
Thank you.
So thank you. So y'all with mask and all that other stuff, Miss Mary, you're right here. With mask and all that other stuff, you got to speak up so folks can hear you. So some of our September folks are, and I screw up names, so I apologize, Rovicia Jenkins White. She is one of our new child support agents. So with this giant TV, I can't tell who's here and who's not. So
We have a barrier.
we have a big barrier. So are you present? And if so, come on down.
Guess not.
I guess you wasn't able to make it. Okay. So then I have Kimberly Melvin, who is a social worker in adult services. And so want to welcome her to the agency.
Welcome, Kimberly.
Thank you. My name is Kimberly Dupree Melvin. I'm a recent retiree from the state of North Carolina. I worked 30 years at Pitt Juvenile Detention Center here in Pitt County.
Wow.
The last 5 being the director at that facility. I decided this year it would be my year to actually retire, but I wasn't quite ready to stop working. So I chose a new path, and Adult Protective Services gave me an opportunity, and I'm glad to be here.
Glad to have you. Thank you, Kimberly.
And a
Nice to meet you.
graduate of ECU School of Social Work.
Yes, ma'am.
Yeah, you had to get that plug in, didn't you?
Good job. Good job.
Yeah. Okay, Titania Wiggins, who is our social worker well, what did I do? Yeah, come on down.
Good afternoon, everyone.
Good afternoon.
Afternoon.
Great. My name is Tatiana Wiggins. I'm serving as a social worker 3 in the permanency planning department under Kelly Clay. I'm
Raise
sorry.
the mic.
Ma'am?
Raise the mic.
Okay. Well, I was saying my name is Tatiana Wiggins. I'm serving as a social worker 3 in the permanency planning department under Kelly Clay. This makes my 2nd year serving as a social worker. I graduated from Winston-Salem State University in 2018. I'm excited to have the opportunity to serve my hometown, my home community, and I'm just grateful for the opportunity.
Thank
Great,
you.
Thank you, and I didn't
Welcome.
screw your name up too badly. Okay, so those are some of our new hires, and we're so excited to have these folks with us. Now, we're saying goodbye to Danita Williams. Danita, you want to come on up? Danita is a lead child support agent for us. She started here as an income maintenance caseworker in 1990, so she's been here a while.
Wow.
She moved into a higher level income maintenance, transferred to child support, got promoted in child support, left for a little bit of time, but came back after a couple of months, was promoted to lead child support agent in October of 2012. So Danita, and she has a few months, I think, with Albemarle, as I understand it, Child Support Enforcement Office. So, Danita brings or takes with her a lot of history, a lot of information, and has been a great servant for Pitt County and for those child support families that she has been working with all that time. So I very much want to thank you for your service and wish you well as you go off into retirement land. Thank you so much.
Thank you for your
Anything you want to say?
Congratulations. Thank you.
Do you want to say anything, Danita?
Wow. Good afternoon. I'm excited. Thank you for Pitt County government for giving me the opportunity. It's been a great opportunity working for this agency. I'm going to miss it, but I'll be around. So if you all need some temporary services, give me a jingle, buzz.
Yep,
And I just thank God for my journey, 31 years total, Pitt County government.
Thank you.
So
Thank you.
we're excited for you. Thank you so much. And that is my report there.
Okay. So should we go ahead and deal with the budget amendment?
Yes.
Okay. So we did have a budget amendment. That's why we didn't approve the agenda. So I'm going to let Jan talk about it a little bit.
Okay. We received from the state at the last minute some CARES Act money for the LINKS program to help with those youth transitioning from foster care into, supporting themselves, being their own person and trying to, deal with the world of work and everything. So We received a total of $95,000. And this has to be, because it is COVID money and CARES money, we have to move very quickly with it. So we, like I say, got the information in the last few days. It is set up to go before the commissioners on the 27th. And so I wanted to have you all take a look at it first and certainly approve the amendment if you choose to.
Any questions for Ms. Jan? Take a minute to look at it.
I'd like to commend the Department of Social Services for this, because when you come out of foster care and go out in the street, you need some support to get the journey started.
Thank you, ma'am.
I commend you on that.
Thank you.
Okay, so we need to approve
We
this.
need to approve it. Uh-huh.
So if there's no other discussion, could I have a motion to approve?
Move to approve.
Thank you, Dr. Bunch. A second?
Second.
Thank you, Mary. All those in favor? Aye. Thank you. Motion carried. Thank you, Dean. Get that out of the way. Okay, now items for discussion. We started maybe 6 or 8 months ago in terms of inviting people in to give presentations to our board and the community, and I think it's gone really well. And today we have a guest, Shannon Carter, and she's from the Area Agency on Aging, and look forward to hearing what she has to say to us today. So if you want to come on up, Shannon, thank you.
Good afternoon. My name is Shannon Carter. I am from the Mideast Commission Area Agency on Aging. And Susan's going to give you guys a brochure about our agency. You know a little bit about our agency due to the HCCBG monies that we do. I will tell you that the AAA, which is what we're famously known as, we are a part of the National Aging Network created by the Older Americans Act, dedicated to improving the lives of older Americans and their caregivers. As the lead agency in Region Q, we cover 5 counties, and Pitt being one of our counties. We administer federal, state, and local funding through local agencies, and they provide services, opportunities for the age 60 and older population. We monitor all funded programs to ensure quality standards and financial arrangements requirements are met. We facilitate planning for aging and disabled adults at county levels to determine the needs and strategies to meet the needs of the aging population. We serve as a clearinghouse for information of interest for older Americans and their caregivers. We provide training and technical assistance concerning aging issues and resources. And we host listservs and other group communication networks to provide program consistency and quality throughout the region. So just going through the brochure and telling you guys a little bit about our programs, one of the programs that we have is the Long-Term Care Ombudsman. And what that position is they are advocates for our facilities, long-term care facilities, our adult care homes, and our family care homes. So what they do is they are the advocate for the resident. We want to make sure that a resident's rights are being done fairly and that they are not being penalized for things. It could include things as discharge. The long-term care ombudsman actually will go with that person and facilitate with them to the state for hearings to be held, appeal hearings. They also do quarterly visits to the facilities, and it's not we want to catch a facility doing something. It's, hey, this is something that if the state comes in, you could be fined and penalized for, and so we just want to help you see those things. We are a liaison between the families and the facility if things cannot be resolved on the family's end or the residents or for the resident at the facility. And also, they do trainings for the workers. We do resident rights trainings for the employees of facilities. Another position we have is the Family Care Support Program. This person is actually taking care of the caretaker. If a caretaker is burned out, then the loved one is probably gonna suffer down the road possibly. And so this person looks out for them. So we have respite grants that we can offer to family caregivers so that they can get out just for 15 minutes to an hour to 3 hours to a weekend, sometimes for a week. We can offer those respite grants to them. And we also cover support groups. Being a caretaker is a tough position. If anyone's ever done it, you know. And so having that support and having others to feel like they're right there with you, it makes a huge difference. We also have Money Follows the Person demonstration project. What that is it basically is money follows the person. So this is for residents in long-term care facilities, a qualified resident that is able to go back out into the community. We can help facilitate that and help them apply for that program. And then there's a money pot attached to it that can assist that family in getting their loved one out. The biggest thing right now is housing. If they don't have somewhere to already like go back to their home or to a family's home, then sometimes it's going to take a little longer, but it is available for people in long-term care facilities. We also have evidence-based programs. This is a wide range, and listed below, you'll see the programs that include, we do workshops with citizens in the community. A lot of times we do partner with the senior centers. However, it's not limited to that. We can provide, we've done it in churches, we've done it in senior living housing areas, apartments, but we do a matter of balance classes. We can do walk with ease, living healthy, chronic disease self-management, and we're now just piloting, we're gonna be doing a diabetes workshop for people with diabetes. Powerful tools for caregivers, and we also have a program called Home Meds. This is an awesome program. It is totally free, all free for the community, and it's where we can do one-on-one with a person to look at their medications. So it's all confidential. We put it into a database, and if it flags, if their prescription meds and their over-the-counter meds flag, we have contracted with a pharmacist who will contact that person and talk with them and offer to talk with their pharmacist or their provider about the possible reactions or issues that they could possibly end up with by mixing their medications. Also, our aging service coordinator, she also does Medicare Part D open enrollment. So from October the 15th till December the 7th is open enrollment for Medicare Part D. Again, it's all complimentary to the community. We go in and assist them. We do not make decisions for them. We actually go in and let them see the comparisons of several programs. If they choose to change their Medicare Part D, at that time we can assist them with that if they need to. Our aging service coordinator trains local providers and does all our monitoring for the funding sources that we use. So with that, we're kind of a little bit of everything for the community. Again, our services are complimentary to the people in the community, and we are usually in and out of the communities. We work closely with the senior centers, social services, and other local agencies. Any questions?
Thank you, Shannon. Questions for Shannon?
I have a question. What is the portal of entry into your services? Can individuals just call your agency?
Yes, ma'am.
Okay.
We are usually at any type of vendor events, community events, and we hand out information along with our brochure that does have our number on it. And they can just call our agency, and they usually, if they end up calling our main number, they are transferred to one of us, and whoever does that particular job will contact that person back and assist them.
Okay. And you coordinate with other aging services in communities?
Yes, ma'am. Yes, ma'am.
Well, that's the question that I wanted, but this is the number on here for you that we can call.
Yes, ma'am. That's
you
our
staying
main
for this
number,
entire
and so,
meeting?
and then now on the back, each of us that are different, have different positions that cover these programs, our individual numbers are on the back.
Are you staying this entire meeting?
I'm sorry?
Are you staying this entire meeting?
Yes, ma'am.
I think she wants to see you afterwards.
That was a nice way of saying
Right.
that, Mary.
You know, one thing you might want to share with the folks is the Home and Community Care Block Grant and the various things it funds. Now, it funds it through, it's given to a variety of agencies, but I'm not sure everybody here knows what it funds.
Part of that funding is, you've heard of the home delivered meals, Meals on Wheels. It funds those programs. It also provides in-home aid services. So right now, we do partner here with Department of Social Services, and they actually are able to provide in-home aid services for clients. The HCCBG money also, in some counties, offer home improvement, which could be a ramp or things like that in the community. We also have transportation in some communities. Each, like she said, different agencies are over the different programs. And so, and the counties, some of the counties have a little bit different programming, but all 5 counties that we do have the home delivered meals and the in-home aid services.
And congregate meals still?
Congregate meals also.
Right. And I know we have adult daycare, a limited adult daycare program that, through one of our programs here in the county.
And we also have legal aid services.
Right.
For the 60 and over population. So we partner with the legal aid here in Pitt County that provides services for all of our region.
Good stuff.
So lots of resources for our older adults. Sometimes there's not enough to go around.
Right.
And y'all have some money coming through the federal COVID relief, but I don't think you yet at this point have a good idea of how all that's going to play out. But there is money coming through that to help support seniors and others in the communities.
Something that we have been able to do in Pitt County with the CARES money that came through our program, we were able to, there's a program here in Pitt County called Exceed. And Exceed, especially in the fall last year, was able to assist about 100 families in produce boxes, meat boxes, vegetable things for families, just a variety. Also, Pastor Coles also was able to do that with a variety of people, and things it kind of covered, it assisted with, like for Pastor Coles, he rented U-Haul trucks that he was able to deliver the food to the community and to the clients. And so the CARES money has been able to assist, like the senior centers, with needing equipment to sanitize, and everybody got masks, I think, and extra masks and even more masks, but they're covered. So the CARES money's been able to assist. I know it's assisted DSS in several things with the home delivered meals or the clients that they have that they participate with.
Thank you, Shannon.
Thank you.
So don't go anywhere.
Okay.
That was very good. I'd like to hear about partnerships and people working together.
Leave my property alone.
So next on our agenda is recognition of Child Support Month activities, and I think we're going to hear from Sonia Scott.
And come on down, Sonia, and we have exciting news about Sonia.
Oh.
Sonia is the new Michelle. It'll be a couple of more weeks, but she will be the new Michelle. So we are excited to
Congratulations.
be able to give her that opportunity, and know she's going to do a great job with it.
Thank you so very much. So I'm here today to talk to you about Child Support Awareness Month. We've had a very great year despite the pandemic. Am I supposed to control this?
Susan, can you help her get to her?
as you can see, the goals and objectives of the child support program that we have here, our paternity establishment, percentage of cases under order. All of these are the federal requirements by the child support program. And each year, these goals are assigned by the Federal Office of Child Support Enforcement. And if you look, our Senate goal performance from last year, that would be from July of 2020 to June of 2021, we exceeded in all areas except for one. We missed it by 0.55%, but that is still outstanding due to the pandemic and the challenges we faced during the pandemic.
And
I
court was
would
a
like
big
to
one.
Yes, I would like to report that we did collect the most I think we've collected ever, $16,581,302 for the
My
fiscal year
goodness.
for the children of Pitt County and surrounding counties. So that is awesome with the challenge that we face with the pandemic. We had to reduce our court calendar size because we had to limit the number of individuals we could have in court at a certain time. So even with those challenges, we were able to collect that amount of money. So great job to the child support team and of course to the Pitt County
Oh,
DSS
yes.
family. Great job. Also, as far as our self-assessment, those are categories that are also mandated by the Federal Office of Child Support Enforcement. And we were able to meet all of our goals this year, as you can see. We exceeded all of our goals except for one area, which was our expedited process for 6 months. And that is pretty much, again, due to the challenges that we have with the number of individuals that we could have in court. And also, we have faced challenges with deputies in other counties being able to serve our documents. So even with those challenges, we still managed to do very well in the area of self-assessment. And so August was Child Support Awareness Month. So we had several activities for staff and the community and our partners for the month of August. And so we kicked the month off on August 7th with the Child Support Awareness Walk that we had at the Human Services Center. And we had members from our clerk's office to join us. We had our deputies to join us. We have members of our DSS family to join us, as well as our legal department and our own very deputy director, Dr. Frazier, join us with our walk that day to kick off the month. And we had a great turnout. Have a little picture there for everyone to see that we took afterwards with our walk. So staff really enjoyed that, and so we do appreciate all that assisted with us in celebrating that. On August 12th, we hosted a free DNA testing date where we waived all of the DNA testing fees for individuals. We actually collected 55 samples on that day, which is great. And we also allowed individuals to make same-day applications, so they could come in on August 12th, make an application for child support, and head straight into the conference room to have their DNA testing. In addition to that, we had our social worker with our employment services training program. Our new program, we have the STEP program, which is the supporting, training, and employing parents program that we have with child support. We have a social worker that is assigned specifically to work with defendants in our child support caseload to assist them with finding jobs. And so she was on site with us the entire day, and she made contact with several individuals and enrolled them in the program. And I do like to report that we've had our first success story with the Employment Services and Training Program. We have an individual that was able to obtain part-time employment at Vidant Medical Center. And in addition to that, he's also enrolled in Pitt Community College in the Nursing Assistant Program. So congratulations to him on that, and that is our first success story. And some of the things that we did in August for our staff, we had a cookout on August 20th for staff, hamburgers, hot dogs, all the goodies. And on August 30th, we had an ice cream sundae day for staff. And this year, Normally, we have our annual conference, and it's usually at different locations, but this year, from August 25th through the 27th, we held our first virtual conference, which was a huge success. I do like to note that our supervisor, one of our supervisors, Renee Davis-Jones, she is the treasurer for the North Carolina Child Support Council for the 2021-2022 year. And I am the president for the 2021 and 2022 president of the North Carolina Child Support Council. So we were nominated to serve in those positions with the North Carolina Child Support Council. So we look forward to working with the council this year. Any questions?
I have a question.
Yes, ma'am.
First of all, I'd like to congratulate you on all of the accomplishments of this unit
Thank
for
you.
the past year. But what is the usual cost of DNA testing?
The usual cost of DNA testing is $25 per individual. That fee we are reimbursed for a portion of that fee from our federal incentive money.
Okay, thank you.
I thought that was very good to do, and that's the first time I've heard of that. We're very pleased that was great creative thinking.
Thank you, and we are actually hoping to, and we're planning to implement that every year, to do it at least once a year, to get that going, because we did have a great turnout. We had quite a few people that inquired that were not eligible, because paternity had already been established, so even though we had quite a few of individuals to appear and numerous telephone calls, so I think it was very successful too. I do agree.
When I heard about it, I was quite pleased.
Thank you, thank you.
And one thing y'all need to know is child support during COVID has really been challenged because the court had them in a tent on the sidewalk much of the year,
Yeah.
checking folks in and trying to control traffic within the courthouse. And so to have staff outside in, the
cold,
winter,
the
the
rain.
summer, the whatever, doing that was, your folks did a phenomenal job, and we really appreciate what they did.
And all of the staff, they accepted the challenge so that we could continue to provide excellent services to the families. They accepted the challenge, so I'm very proud of the team.
Sonia, great work.
Thank you.
Those collections, that's really awesome.
Yes.
That's really awesome. I know this must be very difficult work, also rewarding. So if you're coming in behind Michelle, I know it feels like you're filling big shoes, but like I tell my folks at the hospital that are coming in on the backside of somebody that's real successful, bring your own shoes.
Thank you. Thank you.
That's
Thank you
Good
so
luck.
very much.
Is it possible I can get the STEP awareness contact emailed to me?
I sure will. I'll email that to you.
Thank you.
Thank you.
Thank you, Sonia.
Thank you.
Congratulations again.
Thank you.
You're welcome. Okay, moving forward. Director Selection Committee, I guess that's me. I just want to
You better do a good job, too.
I just want to recap, and that's me on the agenda. That's what I'm saying.
You're not the committee, right?
That's right. I am just.
All the way.
I want to recap in terms of where we are, and as I said last month, that if you read your little red book, your Department of Social Services, kind of your responsibilities as a board member, the selection of a new DSS director is one of our primary, most important responsibilities. So we need to take this very seriously in terms of things, and I know that we will. Last month, we had Ms. Forta Hardy come and give us a briefing in terms of kind of process and things that we needed to keep in mind as we go through this process. And our goal was to go ahead and get a job description posted by the first of the month. And I think we accomplished that. And I know it's out there, and I want to thank everybody that weighed in on that. In terms of, I know that we did some tweaking of it, and so the job description's out there. And it's my understanding that it's going to run for 30 days. So our next step in this process will be developing a selection committee. And I think that's our item for discussion today in terms of that. We learned last month that if we have 2 board members on that is not considered, we don't need to formalize that process. We can meet without having to go through a formal process. So the discussion was to identify 2 board members and then also some community members that could join us in that process. That Ms. Hardy would do a eligibility assessment in terms of the applications we got. The committee that we put together then would go through a selection process and narrow those applicants down to whatever number they decide. And at that point, we would try to narrow it down to probably 2 candidates. Those 2 candidates would come to this board, and we would interview those 2 candidates at this board and make that ultimate decision. So this is all going to happen between now and the end of the year. So
Just 2 candidates?
well, the idea is that we've opened it up. Ms. Hardy is going to screen for those that are eligible for the position. The committee then the committee that we put together will do the screening. And the idea was that committee will probably interview somewhere between 4 and 5 people and try to narrow it down to a couple. I mean, that was the discussion that we had last month. And then those couple would come here, and then the board would have an opportunity to interview those 2. So I am open to discussion. If I left anything out, we can talk about it. But that's what I see as kind of our responsibility and our tasks, and those are our benchmarks that we need to do.
Did you say the entire board will be going through the application, or just the board on the screening committee?
The idea that we talked about last month was that we would, the team that was put together in terms of the screening committee would screen those applicants. And then again, the final 2 that came down then would come to the board here. So is that what everybody else remembers?
Mm-hmm. Yep.
Yes.
Discussion, thoughts?
So is this the point that we
Well,
need to determine who that other board member is? Or the 2 board members that are part of the?
Well, I think that's our discussion now. Mhm.
Okay.
Is
And
there going-
then also what we need to do is, I want to be thoughtful too about the number that we need of community members on that committee too. It was thought last month when we talked, maybe 2 additional members, but then it was brought to my attention that we had 4 members. We probably we would need a tiebreaker, so we probably would need 5. So that gets into scheduling issues, and that makes things more complicated in terms of things. So again, I am putting this out there for discussion and ideas and thoughts, and so I'm going to be quiet and see if anybody else has anything to say.
Mr. Chair, I would recommend Mr. Dancy, given his expertise in human service development and hiring, to be part of the screening committee.
Okay.
Second? Is that a motion?
I can move
Can you move that so I can second?
that Mr. Dancy
I guess
be
I
a
have to
part
accept
of
first,
the
I know.
screening committee.
Okay.
He
That-
has to accept.
Well, once it's been moved and seconded,
It's done.
Sorry.
So I
we
have,
will add to parliamentary procedure, and he has to say yes.
so we have a motion and we have a second.
Yes.
So I guess there needs to be you're willing to do this?
Yeah, sure.
Okay,
Yeah.
great, wonderful. So we have a motion, we have a second, so all those in favor that Mr. Dancy be a member of that screening committee, say aye.
Aye.
Okay, done. So we need to identify another board member to be part of that process.
I have a question. So, the 2 board members, would that include the chair in addition to the chair, or just 2 board members?
2 board members.
Okay.
I'd like to nominate Dr. Bunch to be our other person.
I see a deer in the headlights.
Oh, sure, why not?
So do we have a second?
Second.
Okay, so we have a nomination, we have a second, that Dr. Bunch be that second board member in that selection committee. All those in favor say aye.
Aye.
Okay, so we have identified our 2 members from the board. I think the next step would be for you two to get together and kind of talk about the composition of those other members in terms of who you want, and to develop a little bit of a timeframe.
Will I be able to view the application?
I think that you'll be looking towards your 2 committee chairs, for that.
And, if you've got 100 applications, trying to screen through 100 applications is pretty significant. What we have talked about is that the top 4 or 5 would then go through an assessment process to determine if they're the appropriate folks to be considered. And that information would be part of that process. Y'all could talk about whether the top 5 y'all want everybody to look at. When the recommendation's made about the top 2, I think that's certainly something y'all can make a decision about what you want to do. That's
Absolutely.
your decision. I'm not part of this.
Yeah. And Jan had circulated the information about the screening process that we would use in terms of once you had kind of narrowed things down, that you would send this out to those individuals and have them return the questionnaires relatively quickly. And we had talked about that. So that.
And they're not scored by us, they're scored by a company.
Okay, so clarification. So Mr. Danson and I will serve on the selection committee, and who else? Somebody from city government, county government, Scott?
So we, last month, we talked about possible individuals. So I think we had identified a
City
couple people
manager.
that would be good candidates, and then
County
the
manager.
thought was that we probably would need maybe one additional person to have 3, but that's something we can talk about, or you can talk about in terms of things.
Okay.
But I think that's part of the committee's challenge or thought process in terms of who else to involve. And I know that Mr. Barnett over there, we had mentioned his name. So I think that would be a good selection.
He had done like this.
So, as a possible candidate, and then we had also talked about a couple other folks too, so we can. So, any other thoughts, discussion? This is. So at that point,
I've been through this once already,
yeah,
and, I'll wait and see.
I want to thank both of you for agreeing to do this.
I did have inputs into this,
You did, yeah, I
I
saw
did
that.
make comments into
Yeah.
that, because,
Yeah.
uh,
So certainly if any other way that the other board members can be a part of this process. just
but
let
I
us
do
know.
want to see the applications when they come in, based on some.
Well, we won't see all the applications, period, because Florida's gonna screen the applications to determine who meets minimum qualifications.
That's being done by the agency out there.
Yeah, and so Florida then will submit to the group that's doing the work, the qualified applicants for their review.
Okay. It's quite
So
different.
we're not part of this, we don't have a contract, we're using our internal resources, to make, best do this, to be very different than what was done in 2014.
I thought we made a good choice myself.
I think you did too,
Even though we
Mary.
had to go back the second time, I think we made an excellent choice. And that's what's concerning to me.
Okay, any other questions, discussion? And again, I want to thank you for your willingness to do this, and good discussion and good process. Thank you. Okay, we're going to move on to Dr. Frazier's, the report, Deputy Director's report.
Good afternoon.
Good afternoon.
So it's been 3 months. We have gone into the Medicaid transformation. And I want to report to the board that we are seeing very little hiccups. The state has been able to roll out the Medicaid and troubleshoot most of the problems and make sure they respond to challenges or questions within 24 hours. That is very good. And they are now meeting twice, every 2 weeks. The Ombudsman, the PHPs, and providers are meeting every 2 weeks to make sure that the rollout is seamlessly delivered to the population. Additionally, DHS has been able to provide telehealth programs, how they can reach people during the COVID variant increase. They have also provided them with alternative internet sources so that they can dial in, reach out to their PHPs or to their healthcare providers or to the enrollment brokers so that they can change or alter anything they want to do by September 30th. After that, you are stuck with that until next year or the year after, or if you have any extenuating circumstance, like a death or a childbirth or something else. So there is a frequently answered questions that DHHS has also designed to help people and customers to go into. Ask those questions based on some of the questions that they are getting from providers. And that is very helpful to even us DSS so that we can also go in there to troubleshoot some of the questions that our clients would ask us. These also are available in both Spanish and English. So there is a very good endeavor on the part of the HHS to reach out to even to our hard-to-reach populations. There is a concern, however, that has arisen. How are pregnant women family planning covered? Are they covered under the new Medicaid transformation? The answer is yes. And DSS still has to do what I call the preliminary checks. So once they go through that, they are covered. I did a presentation for uninsured with the Vidant Hospital, and we discussed some of these exigents, and we were able to dialogue and send some of the questions to Amanda Perez, who is our liaison. And those answers are back, and a PowerPoint has been presented to Vidant. Any questions on transformation? CDBG, yay! So this month, we altered some of the criteria to qualify for the program. We had close to about 42 inquiries just after our alterations. So there is significant interest in our programs now, and the numbers of calls have gone way up. We have been able to serve, as of today, 14 customers who has fallen through the low income bracket, 17 very low income bracket, and 48 extremely low income bracket. So the program has actually worked for the people for whom this program has been targeted. which is very good, and it is still available. So I will encourage people to still check, call if not anything, check out if you qualify. So it is available and it is there for you guys. Rental assistant is still ongoing. We still have only qualified one candidate as of today. We have 22 pending. By next week, those 22 will be decided upon, and we'll be able to report in the October meeting what is the outcome of that. With that, I will answer any questions from the board.
Yes, I have a question. What are the qualifications? I've already had a couple of questions on CSBG. What are the qualifications so that the public can hear them?
If you are behind by,
And I stay at the mic.
if you are behind by X number of months, and it is due to COVID, and you meet the income bracket, yes, you qualify. It is not a case by case. There is no way we can say we can do a case by case. It is very straight and dry. It has to be COVID related, and you must meet the income bracket. Those two must be going together for you to qualify for this program. And you have to live in Pitt County.
You said what?
You have to be a resident of the county.
Oh, okay.
Yeah.
What about age?
Age has nothing to do with this program.
Other
You
questions?
must live in Pitt County. You must meet the income
Income level
qualifications.
threshold, yes.
And what was the third thing?
And it must be COVID related.
It must be COVID
Related.
related
Yes,
in order to qualify
correct,
for the CSBG program.
correct.
I just want to make sure. Did I leave out anything?
No, you did not.
Thank you very much.
And it's rental assistance, not,
It's rental assistance.
Rental assistant for that one, and even the utility assistant as well.
Does the money go to the tenant or goes to the?
The landlord. The check is written to the landlord.
Okay. And how does the
The
tenant
utility,
know?
the utility goes straight to the utility provider.
I missed that.
the utility information goes straight, that check goes straight to the utility provider too. But what she was asking was, how does the tenant know that their landlord's been paid?
Well, they will get a note they will be there at settlement with the legal aid clinic. The landlord, the tenant, our representative, and legal aid will be there. All parties will be present when the check is written.
Okay.
And I guess one comment needs to be made. We have sat for months trying to get folks to apply, and so we've been spending the admin money that came with this program. And unfortunately, now that the program is picked up, we've about used up all the admin money. So we're going to have to figure out if we can use any of the ARP funding to assist so that we can keep folks in place.
Correct.
But that's a discussion elsewhere.
The reason I was asking questions, that was my holdup. There was a couple of questions about CSBG and why.
Okay.
Any other questions for Dr. Frazier?
Yeah, that's it. I'm finished.
Okay, thank you.
Thank
Thank you,
you.
Dr. Frazier.
Thanks.
Okay, I'm going to turn it over to you, Jan, for your director's report.
Okay, and I'm gonna try and make it real fast.
Okay?
There was a lot of dancing in the street when we passed the Medicaid report card. There was some real fear that we might not make the 90%, but as always, we have some outstanding staff who tend to pull rabbits out of hats. And so we passed the application timeliness processing for the month of August. And so we, 95% for other Medicaid and 90% for Medicaid disabled, which is where we have to be at a minimum, is 90%. So I want to thank the staff for making that happen. as you can tell from some of the folks we've been bringing, we had a bunch of vacant positions. We have filled 13 positions since our last meeting. Not all of those folks are actually, I think, on board yet, but they will be here shortly. And again, we still have 25 folks. Services is where the bulk of it is. But we are, involved in interviewing and advertising and background checks and all that kind of thing. And so that is moving very quickly. You noted that the Brady Bear fundraiser is scheduled for next week. Actually, it kicks off this Friday. Certainly, if you have not gone down and ordered some bread, we would encourage you to do that. If you can go down there and make a bear. I think Chandra has sent out some invitations to folks, and I know a few of you all have accepted those invitations. But even if you can't go make a bear, go buy some bears. They are tasty, and they certainly have been very helpful as we work with our foster children and all the special needs that they have. So I wanted you to be aware of that.
Can you tell how much the bears are?
I do not remember off the top of my head. You just ordered yours. How much?
I don't know, I didn't ask. That could be $50 a bear, I don't know.
My pocketbook isn't like
I'm
that.
thinking, I haven't looked at this year's, but I'm thinking like $12 to $14 is what we paid in the past.
Now, where is this?
Great Harvest Bread. So certainly,
Great Harvest
Great
Bread
Harvest Bread on Evans.
On Evans Street.
Right, so certainly want to encourage folks to go out there and do that. Board member training, we had a board member training planned, and then they pulled it back, and it's been rescheduled. I think several of you all re-registered. If you have a question about dates or whether you're registered or not,
It's been rescheduled?
it's been rescheduled, right? I can send you the information if you have questions about it, okay?
So this will be the third time or second?
No, it's been
Just one
rescheduled
time.
back to November, I think
Right.
is when it is.
Yep.
That was the initial rescheduling.
Right.
So,
Dan, do we have a date?
yes, ma'am, we do. I did not bring it with me.
Oh, okay.
But I can tell you, like I say, I can send it out to all y'all. You can look to see. I can't remember, some of you just rolled your money over, your registration over. Some of you said, I'm not sure I can go then, so you pulled it back, and I'm not sure who's who. So I'll send you the dates, and you can reach out to me if you need to know anything, okay?
I saw it, but I really don't remember it.
And you
Zoom
know,
is crazy.
right, you know that the legislature is putting into legislation this year that DSS board members have to have annual board member training as part of the roles. So I don't know if that piece is passed yet, but it certainly was in the legislation. It's not effective today, so this training would not be impacted by it. So that's pretty much all I have.
Thank you, Ms. Dean. Good meeting. So, board member comments. Dr. Bunch, you have anything?
No, sir.
Okay.
I wondered how social service was gonna function with all these masks, social distancing, stay away from folks and stay home and all of this. And there has not been any complaints relating to not being able to reach the services at social services. And frankly, anything related came today through a message this week having to do with the CSBG. But
Yeah.
I just want to say, hey, that's just water under the dam, because you have been a great staff during this time, these perilous times, and you all have done a wonderful job. Is LEAP going to happen this year? Okay, I know I was late. but-
And you may have water. The federal government is gonna try and pay people's water bills. But we're not sure
I
how.
hope we do, because I drink my water out of a bottle.
Well, you know, again, it's a COVID-related
Yes.
past due bill kind of deal. They're in contact right now with the various water companies in the state to try to get a sense of what we're looking at. And the state has to have a plan that the federal government approves, so we're a ways out yet, but that is being worked on.
That's wonderful.
Catherine, any comments?
Stay safe.
Mr. Dancy?
No, I'm good, thank you.
Okay. If no other comments, if I give a motion to
Let's
adjourn.
move, let's close.
Okay.
Motion.
Second. All those in favor?
Aye.
See you next month. Thank you.
Thank you.
Yeah. Let me see if that person is complaining to me and stuff.